in the September 2012, I had quite a nasty accident, and it had caused quite a lot of damage to my TMJ joints. I'd also damaged my teeth. My bite had gone, which was a complete new thing for me, and I was in a lot of pain. I had constant earache, I had tightness in my neck, I had general facial pain. I was in a lot of pain. Luke was helping me with my TMJ and I was getting some physiotherapy, but he really felt that perhaps you could offer me something to reduce the amount of pain in my face. So I arrived here and in quite a state, quite emotional, in an awful lot of pain, and anyone who's been in a lot of pain will know what it's like to wake up in the morning and think, how am I going to get through this day with this noise in my ear, with this pain in my face, with nerve pain and with joint pain, not to mention the headaches that you have with TMJ dysfunction. Well, I've been working with Gina now for the last 2.5 years, and Gina started me on a, I suppose first of all she assessed my problem. So she looked at the problem and it was multifaceted. So first of all we had to break down the issues, we had to really investigate what was going on. So first of all Gina did some fill-ins, and then we started looking at my face, and I had a major nerve problem caused by some damage, and Gina referred me to another specialist and we managed to diagnose that problem, and Gina then referred me to Luke Cascarini to remove a tooth, which straight away eased the nerve issues that I was having in this side of my face. I still had a lot of pain in my joints, in my face here, and Gina felt that probably the main reason for that was because of a bad bite. And I'd never had a bad bite until I'd had my accident in my face, but obviously it caused a bad bite. Gina recommended a treatment called Invisalign. I'd had a brace in the past and it actually made my TMJ worse, so I was very reticent to start this form of treatment. I was anxious that it would make my TMJs worse, I was anxious that it would make my neck worse, but Gina showed me how it would work. She took her time, she didn't rush me, and we discussed the process at some length. And I started on Invisalign treatment in July 2014. Absolutely. I remember going on holidays to Spain, telling my husband I didn't want to wear the brace until I'd had my holiday because I didn't want to be in more pain after the brace. So I think I was very anxious about having this brace at all. In hindsight, I should have had the brace before the holiday, because that night I remember wearing it for the first time and sitting in bed with my husband crying because I just said, the pain is eased, the pain is eased, I don't want my painkillers. So it's been quite an emotional roller coaster really. And since then it's gone from, it's got a lot better. I feel like every day I can do so much more. I'm a teacher, I find teaching far easier. I have a lot more energy with the kids. If anyone's been in pain, they'll know what it's like to struggle every day with little children, and to have that relief from that facial pain has been a godsend. It's been absolutely amazing. The reception team are great when you walk in. I've walked in on days when I've been struggling with pain, and Don has always been fantastic, making me feel relaxed, having a little chat, but at the same time very professional and very courteous. Gina and her colleagues at the practice are always very keen to listen to the issues you have. I think they see that as one of their primary responsibilities in order to formulate a possible solution for you to be able to reduce the amount of pain you are actually in. So Gina's always been exceptionally professional, exceptionally courteous, exceptionally kind, and empathetic when days I've come to the practice in exceptional pain. So I've always appreciated that. Yeah, obviously it's expensive. Invisalign it is a treatment that you have to pay for. It's not a free treatment. I would say it was worth every penny. Gina said at the beginning, this may reduce your pain up to 60%. I would say it's reduced my pain up to 80-85%. For me, the big thing is I'm no longer on painkillers. I no longer am thinking about my face all day. So yes, it was definitely worth, and still is worth, the investment. I think from my perspective, I'm talking to someone who's been in a lot of pain. So if you have severe facial problems, if you don't find a way forward through the conventional means, I would suggest to you to come and have a full assessment with Gina and the team here. Don't rush treatment. Find someone who knows what they're doing, like Gina, like Dr. Luke Cascarini, especially if you've got TMJ issues as well. And to have a full assessment here. Gina will listen to your problem, she will empathise, she will give you, all your options will be open to you. She won't just say you have to do this, she will give you a variety of options so you can actually make an informed choice about what option you wish to pursue. And definitely from my experience, she's given me my life back.